Welcome, health seekers. I've got something really exciting for you to learn and apply to help you thrive starting ASAP. So first, let me introduce myself. I'm Dr. Krista Coombs. I'm the owner of AcuPlus Wellness Clinic in Lethbridge, Alberta. You can find me at my websites, acupluswellness.com, and you can find me at drkristacoombs.com if you have hypothyroidism and Hashimoto's. It's a more specialized website. Now, a little bit about myself. I've been a doctor of traditional Chinese medicine, functional medicine practitioner, and an acupuncturist for 20 plus years. I am patient obsessed when it comes to helping them navigate complex immune conditions especially, and I love helping you improve your quality of life so you can thrive. So now let's talk about you. How can we help you up-level your health starting right now? Today, we're going to talk about just one factor in healthcare. It's one vitamin that nearly half of North American population is deficient in, especially older adults, young women, and infants. And when it comes to people of color, the rate of deficiency of this vitamin skyrockets to almost 75% for the Latinx community and over 80% for the Black community. So it's a pretty substantial vitamin, and if there's a deficiency, it can really knock your health out of whack. So what vitamin is this? I bet you can guess. It's talked about a lot this year during the pandemic. So that vitamin is vitamin D. Now, just for clarity, a lot of people call this the sunshine vitamin. It's not really only the sunshine vitamin. I'll explain that in a second. There are two types of vitamin D. There's vitamin D2 and vitamin D3. There are other subtypes, but those are the two main types. Now, vitamin D2 is predominantly from plant-based foods. Now, vitamin D3, on the other hand, you get through sunlight exposure to bare skin, which I'll explain here in a second, and from certain more animal-based food products. So the vitamin D2, yes, it's really important to have a rich variety of vegetables, but not because you want to get the vitamin D from it. It's not really the best source of vitamin D. Vitamin D2, in fact, at high levels, if you're supplementing with it, can be very, very toxic to most bodies. Vitamin D3, on the other hand, is something that your body can use very readily to convert to a hormone to use for all kinds of body functioning, turning on genes, getting calcium into tissues, and so forth, modulating the immune system, etc. So when it comes to sunlight, which is arguably one of your best ways to get vitamin D3, we've got cholesterol that will show up in our skin, and through some really cool, magical kind of biochemistry, the sunlight, certain UV direct exposure will have that cholesterol eventually turn into a form of will turn into vitamin D3. And then your body will transport it around and use it as it needs it. We'll also store some of it because it is fat soluble. Now, food sources would be things like some really fatty fish. So think tuna, but not, certainly not in high amounts because of heavy metals. Sardines, salmon, trout, herring, halibut. These fatty fish, as long as they're sustainably caught, please. Those fatty fish are very rich in vitamin D3. They do all the work for you. But then you can look at meat sources, especially organ meat, and eat eggs and even dairy. Now, dairy for a lot of immune-compromised people or people with autoimmune diseases, etc., and certainly people who have digestive enzyme insufficiencies and allergies can't handle dairy. So be very mindful. Don't just go out and just buy a bunch of dairy just to get D3. There are other ways to get D3 into your system that don't involve dairy. But dairy, again, is a really good source of vitamin D if you can tolerate some. And then we would think about supporting vitamin D. And why is that essential? Vitamin D is essential for immune system function, mental health, bone health, heart health, and has been shown to be very helpful in management of various cancers and diabetes. It's a pretty big deal. If we want to increase the vitamin D, like I said, we want sun exposure, whether it's only, direct sun exposure with direct skin, with direct sunlight from on warm days or even non-warm days. That's really, really, really pivotal to getting your vitamin D level up naturally. And then, of course, a really rich diet, like we talked about, that's high in vitamin D. But you can also supplement. Now, everybody's out there buying a bunch of supplements. Be very, very, very careful. Vitamin D3 is fat soluble, so your body will store it, and you can take too much. And the literature is starting to become very, very clear that if we only have vitamin D3 and we don't have adequate levels of vitamin K2 and vitamin A, then your vitamin D3 can become toxic very, very quickly at relatively smaller concentrations. So even as low as 2 and 3,000 IU a day, and a lot of people take that already. So it's really very important that you're going to mix these fat soluble vitamins and use them because they work synergistically in your body to do all sorts of really phenomenal functions. So vitamin D3. Now make sure that your supplements don't have vitamin D2 in them, because that's a good way to hurt yourself. Vitamin D3, just make sure that that's what it is. So that's 25 hydroxy D3, vitamin D3, or cannabidiol. So vitamin D3, vitamin A in its active form, and vitamin K2, not K1, K2. My key takeaways for this, other than combining D3, A, and K2, is to make sure that these fat-soluble products are high-quality, toxin-free products. So the brands that you're using, do some back study. Make sure that these products are coming from sustainably sourced fish, for example, or algae, wherever you're getting some of this D. That they are made in a facility that make sure that they triple test their products and they're toxin free. They don't have heavy metals associated, because again, they're fat soluble. Fat soluble means they can hold on to all this stuff, and then that gets into you. So high quality toxin free products are key, plus the combination of D3, A, and K2. Hope that's helpful. Now, if we're looking at some of the vital functions of vitamin D3, let's talk about some of the top ones. I've listed 5 here. There are more, but these ones I hope for you to keep top in mind. They help in the regulation of absorption of calcium and phosphorus. Now, this is important for like every cell in your body, not just for bone and teeth, even though vitamin D3 is really helpful for normal growth of bones and teeth. But vitamin D3 is also essential for facilitating normal immune system function. All the immune cells use vitamin D3 to modulate them. It's also important for mood regulation, and it's important for thyroid hormone modulation. So you can imagine, thyroid hormone affects everything. So D3 is one of those pretty remarkable hormones that we can easily test for, modulate the level of, and even do a supplement with. And the best way is through sun exposure and food. That's very exciting when you want to take a lot of control back for your health. So let's talk about what increases your chances of a vitamin D3 deficiency. So we've talked about poor diet, but let's talk now about genetic issues. You can have genetic predisposition, so they're called SNPs, little single nucleotide polymorphisms, that make you less likely to be able to absorb vitamin D3 into your cells. So you can have all kinds of D3 that's circulating in your bloodstream and still have struggles to get it inside your cells to be functional. You need somebody who can ascertain that or kind of guess at that for you, so that you're not overdosing on D3 just to try and get your levels up enough to help, say, with mood issues or immune regulation issues. You can have genetic issues with creating the D3. So there's lots of play there and variability with humans. It could be that you live at a higher latitude, like we do here in North America. Even if you were in, say, Arizona, you can still have low vitamin D3 levels, mostly because you're inside too much because it's so hot, but because it is still at a higher latitude and you're not getting that direct UV stimulation at bare skin to stimulate vitamin D production from cholesterol. It could be that you're living in an area with high pollution. It could be because you're using sunscreen all the time. It could be because you're spending more time indoors and not doing enough outside. And it could be because you have a darker skin tone. There are other factors, but these are the main ones why you could have a vitamin D3 deficiency. And then how do you know you're deficient in vitamin D? Well, the only way you can test vitamin D is through a blood test, and to be accurate. The blood draw, you can do it through a blood draw, or you can do it through a finger prick blood spot test. This is the only way that I know of that you can test for D. Now, we can see that you have deficiency symptoms, but you want to verify a D level. Now, symptoms of severe deficiency that you might be looking for are immune system dysregulation. So think predisposition to being sick all the time, having an autoimmune condition or multiple autoimmune conditions. That's a pretty big red flag right there, especially if they're not managed well. Looking at bone loss or soft, fragile bones. Think about osteoporosis or even some arthritises. Severe body and bone pain, muscle twitching, various mood disorders, especially depression or seasonal affective disorder, which is, in the wintertime, and heart disease. These are all, even diabetes, I should have probably put that there too. These are all symptoms of severe deficiency if these things are not managed well. So you think, if you have those things, maybe you should be really looking at your diet, sun exposure, and probably supplementation, correct supplementation, to make sure that you can start ameliorating a lot of those symptoms and get your life back. So how much vitamin D3 should you take? That's like the $1 million question, because it's not actually a straight answer. Now, in my practice, I generally will recommend that we want a vitamin D level to be between 50 and 70 nanograms per milliliter. That's in general, okay? Not everybody should be in that range or even at the top of the range, but generally speaking, that's sort of the functional range that I aim for. And vitamin D3, I mean testing for 25-hydroxyvitamin D, or another name would be calcidiol. It's not the actual hormone, it's a prohormone. I also recommend that you test at least one time. Test in the fall and then again in the spring to assess a typical pattern for your particular body. Now, some people are going to need to retest more often, especially if they had something like hyperparathyroidism or osteoporosis or heart disease that is being managed. We want to start, a dose and start playing with dose, see how well you handle it. Now, remember, if I don't have genetic information, I don't know exactly what's going to be affecting you. So we're looking at absorption issues. If you have celiac disease, you're not going to absorb vitamin D as effectively unless you're really, really well managed. So those are things that you might want to retest a little more frequently, just to kind of get a feel for how your body is handling absorption of vitamin D3, whether it's through a pill form that is powder, or through a pill form that is liquid, or through sublingual drops. All of those things can make a difference to absorption. And then my of course, big recommendation would be improve your diet. Make it more ancestral based. That suits your body needs, okay? That's essential. And that's the best way. Your body will use vitamin D3 along with other things that are part of your food so that you don't actually become toxic. Get out in the sun daily. I mean, every day you're looking at about 20 to 30 minutes in direct sunlight. You can use a sun lamp. I would encourage you to consider that, actually. There's great ones online. They're not very expensive. And you could, maybe when you're having breakfast, you first get up in the morning very early, do 20, 30 minutes at the sun lamp, kind of just at your face. That alone can make wintertime incredibly awesome compared to what historically it might have been. And then supplement appropriately based on guidance from a trusted health professional. I think that's key. If you're going to supplement, please don't just run out and say, I'm taking 2,000 IU a day. That should be enough. D3, again, is a fat-soluble vitamin, prohormone. It's a pretty big deal that you're taking it appropriately for what your body needs. And the only way to figure that out is through testing. Now, my offer to you is you can call us at AcuPlus Wellness Clinic and we can get you tested. Currently, we can't get you tested unless you have celiac disease or a couple of other things. We can't get you tested through regular conventional healthcare for vitamin D3. So that patients now have to pay out of pocket for vitamin D testing. that's pretty sad in my opinion. However, that is the current state of affairs. But luckily, we do have great accredited labs that are providing some pretty easy to do tests. So I use in my clinic a little blood spot test. So all you do is we prick your finger. I get a few drops of blood on a special paper. We let it dry overnight, and then we ship it away to the lab. Now, the lab that I currently use is Doctor's Data. It's a phenomenal little lab down in the States, and I get great service from them, and their test is high end. It's looking at 3 different factors when we're looking at vitamin D. And the number one, of course, is the 25-hydroxy D3, vitamin D3, or the calcidiol, which I talked about. So my patients actually pay $100 for that test. That's about what it costs with the conversion from the US dollar. And then non-patients, I'm willing to do that for non-patients. Normally I wouldn't with testing, but with this one, because of the real focus on immune system health right now during this pandemic, and the absolute essentialness of vitamin D levels being adequate in that population, I'm willing to do this for non-patients, but they just have to pay a little bit more at $130 for a little bit of time from me and some paperwork so that I can then email you the results afterwards. For patients, it's easier, obviously, for me to make recommendations because I know their health history to some degree or to a large degree, and I can make pretty quality judgments on how to kind of play with the vitamin D dose. For non-patients, because I don't know your history, I would encourage you to either become a patient so that I know about what your current lifestyle is like, and or you can take your results and go to a trusted healthcare provider, your MD or a naturopath or whoever works with you that would have this kind of knowledge, and get some really good quality guidance on how to dose for vitamin D. And remember, you want to combine vitamin D3 from fish oil or singly with vitamin A in its active form and vitamin K2. Now, the doses of those can vary, but we want to have a little bit of those definitely to offset any potential for toxicity with higher doses of vitamin D, which, a lot of us now need to take a little bit higher doses in order to get our levels adequate and to help our immune systems, our bones, our hormone regulation, etc. So that's my offer to you. Please give us a call, 403-942-7070, or you can contact us through the AccuPlusWellness.com page, and we will respond. You can either get the test kit yourself and do it yourself and send it away. I'll get the results and email it to you, or you can book a 15-minute appointment for me to take the blood sample from you. And again, we'll mail that away. When I get it, I'll email the results to you and give you a little bit of advice. So I hope that was helpful. We don't need to make it super complicated here, but just remember that vitamin D is essential for a high quality life. And if you want to thrive, at least look at that right now going into winter. We have a whole lot of kits, and we're ready here to serve you when you're ready. Just give us a call. We'll talk to you soon. Hope to meet you.